Welcome to Nite, a place where learning goes way beyond the classroom. For some, it's home. For some, it's a step towards transformation. For some, it's the beginning of a wonderful journey with like-minded people.
Thanks to the teaching and mentoring activities and Dynamic Incubation Center, I am now industry ready.
Engineering at Nite includes aeronautical, civil, computer science, electrical and electronics, electronics and communication, information science, mechanical, biotechnology, MTech, MCA and PhD. Nite also collaborates with reputed universities around the world to give students an international academic exposure.
At Nite, the focus on research has not only helped me understand my subjects, but reach for the stars.
Nite offers a unique co-op program, an exposure to architects, artisans, and urban designers.
I aspire to be the heart of progress.
Chema is listed in the World Directory of Medical Schools.
I learned the art of helping people smile.
A.B. Shetty Dental College is listed as one of the top dental colleges in the country. Justice K.S. Hegde Charitable Hospital, part of the Nite Group, has 1,000 beds, advanced labs and diagnostic centers, which attract a good number of patients from across South India. Along with teaching and clinical practices, we offer programs in pharmacy, nursing, physiotherapy, speech and hearing, biomedical sciences, and paramedical programs like respiratory therapy technology, operation theatre technology, medical imaging technology, and medical laboratory technology.
I've always been curious about the chemistry of cures. I help in healing. From toddlers to seniors, I care for them all.
I believe I can help improve the quality of other people's lives.
We are blessed with the ability to speak and hear from birth. Not everyone is as lucky. I want to do my bit to help the less fortunate. I am proud to be able to assist a surgeon in the operation theatre.
From simple X-rays to sophisticated MRI and PET scans,
my course trains me to assist radiologists and physicians. The training I have received in testing blood, tissues, and body fluids assures me a job at any clinical laboratory. I help people enjoy every breath.
I believe in the power of research to change the world.
Nuxer is a one-of-its-kind teaching and research center that addresses society's health needs through painstaking research in biomedical sciences, food safety, microbiology, and biotechnology.
What I learn here and at my internship in the University of Minnesota, USA, I will carry with me and teach my community to live healthy and stay happy. We believe in being our own bosses.
The Bloomberg Lab helps students stay up to date with the latest trends in global markets. Students also have access to
we are
Bloomberg
beginning now,
Analytics.
okay? Yeah, you can start. Yeah, go ahead. A pleasant good morning to one and all. The Institution Innovation Council, in association with A.B. Shetty Memorial Institute of Dental Sciences, warmly welcome you all to another webinar on Yes, We Can and We Will. I take immense pleasure in inviting our beloved dignitaries, Honorable Vice Chancellor Professor Dr. Satish Kumar Bhandari sir, our speaker of the day, Professor Dr. A. Kumar Swamy, Senior Consultant Periodontist, Mumbai, Professor Dr. Sriniketan, IIC President, Ideating University, Professor Dr. U.S. Krishna Nayak, Principal and Dean, A.B. Shetty Memorial Institute of Dental Sciences, and all the members of our native fraternity for this auspicious event. I now invite our beloved Principal and Dean, Professor Dr. U.S. Krishna Nayak, sir, to welcome the gathering.
A very warm welcome to each one of you who have joined this very interesting and I should say unique webinar to be addressed by one of the, I can say with conviction, legend in the field of dentistry, my very, very dear friend, Professor Dr. Kumar Swamy from Mumbai. Most respected Vice Chancellor, sir, Professor Dr. Satish Kumar Bhandari, the chief guest of today's function, the guest speaker, as I just said, my own very dear friend for maybe over 3 decades now or more, Professor Dr. Kumar Swamy, who is now into his semi-retired, if I am permitted to say that, but he still does consult. His whole family is full of dentists. His daughter-in-law did her MDS from this institution. Many may not know that. His son is also a postgraduate in dentistry, and he also had his training abroad, did his MS in the US. Another very, should I say, bright young dental surgeon. Other dignitaries, Professor Dr. Sriniketan, the President of the IIC of Nittay University, Innovative Council, and our very dynamic and vibrant proactive coordinator, Dr. Renita, Professor Shastri, I see Professor Shastri, I joined in, head of the Pharmacy College, the Dean, Mr. Vivek Pai, and each one of the participants, my colleagues from the university, college, a very warm welcome to all of you. It gives me great pleasure to welcome each one of you to this webinar, the second in the series, I may say. The first was on 24th, addressed by our own, another very good friend, Professor Chitgupi. And today we have Professor A. Kumar Swamy talking to us emphatically on yes, we can and we will. And you will see that I'm sure that this will be one of the best lectures you would have heard in a very, very long time. Kumar, welcome and thank you very much for sparing your valuable time and consenting very, I should say a relatively short notice, knowing how busy you are. Thank you, Kumar, as we so dearly call him. Thank you very much, sir, Professor Dr. Satish Kumar Bhandari, sir, for accepting to be the chief guest. Your presence means so much to us. You know that your very presence adds so much of value to the whole program. Thank you, sir. Thank you very much. And all my colleagues. And I'll be failing in my duty if I do not. Of course, it's not a welcome. I should thank Professor Dr. Sriniketan for all his help and encouragement. And yes, all the credit goes to Dr. Renita Castellino, the coordinator of the institutional council from our institution, AB Shetty Dental College. Renita, congratulations on the very successful conduct of the previous webinar, one on 24th I'm talking about. And today also, I have no doubt that this is going to be a real super duper hit. Thank you one and all, and have a great next 1.5 hours of interaction with the living legend of dentistry, Professor Dr. Kumar Swami. Thank you.
Thank you, sir. I now call upon our Honorable Vice Chancellor, Professor Dr. Satish Kumar Bandari, sir, to say a few words.
Very good morning. Very distinguished speaker for the day, Dr. A. Kumaraswamy, Senior Consultant Periodontia from Mumbai, the Dean of the Medical Dental School, Krishna Naik, and the officials of Nita University, and Renita, then Prakash, all the other colleagues from Institution Innovation Council. Probably Sriniketan has not joined because of some other commitments, and my colleague MS Muditaya should have been there. Probably he has got some other commitment, and all the distinguished participants. I'm Vivek. Sorry, I called you Prakash. Vivek Pai. It's my privilege to be part of this very interesting program. Probably, as Krishna said, this is the second in the series conducted by the dental school. Congratulations. We firmly believe that to be a world-class university, we should create an environment of competitiveness, unrestrained scientific inquiry, critical thinking, innovation and creativity. I congratulate the Institution Innovation Council, which has been just say 8 months old baby, in collaboration with the AB Shetty Institute of Dental Sciences, organized this webinar on a very interesting topic, and it could be, I understand it's a motivational talk by the distinguished speaker, Dr. Kumaraswamy. I welcome the distinguished speaker on behalf of the university, Kumaraswamy, for this webinar. As you all know, we have succeeded in creating a large knowledge society in this country, as we have more than 1,000 universities in this country and more than 50,000 colleges. But what saddens me or everybody is we have failed to create wisdom, skill and entrepreneurship among the graduates who are coming out of the university. It has been documented that for any country to excel and become a powerful nation, the people should have creativity, innovation, skills and entrepreneurship. We got a lot of examples. We got the best example could be United States, Germany or Japan, and the recent history, the Israel. But unfortunately, we have failed, or I think I should accept that the universities have failed in creating a large creativity and innovative bent of mind among the graduates coming up to the universities. Best example could be the healthcare sector. You all know that the healthcare sector is booming, and annual growth rate is almost 17 to 20%. But if you look at the medical devices, and it's a 30 billion worth sector, and 80% of the medical devices, it may be medical, it may be dental or any other devices used by private or institutions, are imported, and we are depending on other countries. Our biggest advantage is our clinical material and the booming healthcare sector. As I already said, what is required today is how to make it cost effective and affordable to the people. If you take NITE itself, NITE Deemed to be University has got our flagship institution is our 1,000-bed charitable hospital, and we have got 21 rural centers. I'm very proud to tell you that probably one of the universities in the country having large number of dental primary health center or centers along with medical and dental. We have got 21 rural health centers spread out in 5 districts of Karnataka and also in neighboring Kerala state. So our biggest challenge is how to provide affordable health care, affordable dental care. What I feel is we should encourage our own clinicians and young doctors to come out with their problems, what they face during their day-to-day practice, come out with some innovative ideas, solutions, talk to their counterpart colleagues. It could be pharmacy, it could be biomedical science, it could be physiotherapy, nursing, or even our engineering colleges, which are having under the fold of our education trust, NIT education trust, come out with the cost-effective, affordable healthcare solutions. I think with this background, this Institution Innovation Council is very, very relevant. I congratulate the Institution Innovation Council. In a very short period, it has done wonderful work. The last 8 months, they have conducted several programs, including webinars, innovation camps, ideation camps, boot camps. Then we had hackathon. Various activities are conducted. As you all know, we are going through an unprecedented situation caused by COVID-19 pandemic. We are not exception to that. The whole country is going through the unprecedented situation. As you all know, our biggest challenge is the population, and we are talking in the background of 1.4 billion population, almost 16% of the world population living in this 4% of the land mass. I think you can't compare with the other countries. And when you are talking about providing beds, providing oxygen, providing drug medicines, giving a vaccination, all this amounts, that is unprecedented, unparalleled situation we are facing. And I should congratulate the government. They are doing enough work in all these fields, and I think we clinicians should come out with some relevant ideas which is suitable to our country, address these issues. It could be early diagnosis, providing monitoring facilities, daycare monitoring. There are a lot of issues, post-COVID care, rehabilitation of these people. I think university and it's constant college, because ours is still, it's mainly health-related university, and our constant colleges, all the faculty and the residents and the students have got the responsibility of being innovative, creative, come out with innovative solutions. I think in this background, this particular talk, yes, we can and we will, by Kumaraswamy, will be very interesting, refreshing, and I think thought-provoking. I hope all of you will carry very pleasant memories of this webinar. Let us hear him for the next 1.5 hours, interact with him, and carry let us be knowledgeable about what he wants to tell us. Thank you very much. Wish you all the best. May God bless you.
Thank you, sir. I would now like to introduce our speaker. Our speaker for the day, Professor Dr. A. Kumaraswamy, is an inspiring pioneer in dentistry and an expert in the branch of periodontics and implantology. He graduated from the Government Dental College, Bombay University, with his master's degree and pursued numerous and other advanced courses from prestigious universities from around the globe. Sir is an exceptional orator who has addressed accredited national and international platforms. He has inspired young minds by teaching in education institutes in India and in the United States. He has held various honorable positions. He has been elected the member of the Maharashtra Dental Council, past Vice President of the Indian Academy of the Aesthetics and Cosmetic Dentistry, and the Asia Pacific International Academy of Periodontology. He also excels in scientific research writing. Sir has done over 200 scientific presentations in national and international platforms and has numerous publications to his credit. He has numerous laurels to his name. The ICRDO Clinician Award for the contribution to the progress of clinical dentistry in India, Indira Gandhi Priyadarshini Award for contribution towards dental profession, and features in Reference Asia and Achievers of the Millennium are a few of his accolades. It is indeed an honor to have such an acclaimed speaker amongst us today. I now invite our esteemed speaker, Professor Dr. A. Kumar Swamy, sir, to deliver the talk. Hello, sir. We cannot hear you. Please, yeah.
Namaskara. Am I audible now?
Yes, sir.
This is a very special morning for me because, it's mixed feelings. I'm happy and not so happy as well. So let me tell you why I'm so happy. Various reasons, and the primary amongst that is given a chance to reconnect with Krishna Naik, with A.B. Shetty, with the city of Mangaluru, with a batch and a bunch of pioneers and innovators, and got to know a beautiful face in Renita Castellino. This particular talk can be so abstract. There's nothing right and wrong about this topic. And I'm so glad that our Honorable Vice Chancellor laid out the mission, the work that has been done. This has truly made my talk very easy today. Coming to not so happy, coming to A.B. Shetty and Mangalore was almost like an annual pilgrimage for me. I used to visit Sringeri Matham. We belong to Sringeri Math. And I know that the outreach center in that hospital at Sringeri also is under A.B. Shetty Dental College. I was blessed to have worked fleetingly at that center to help them detect and treat some periodontal cases. Being a periodontist, that's the only thing I can do. Also, this annual pilgrimage has got a blimp in the way of absence of visits. But thanks to technology, I still remain connected. And God willing, if all goes well, next month I plan to come that side, and I certainly will let Krishna know. And I know that he always takes pleasure, and it's mutual that I come and speak to the interns about topics that one of the topics that I do have ready is what after BDS. So I would certainly be happy to come and share that if I happen to come that. Talking about these webinars, over the past 18 months, I think a lot of people have got webinars coming out of their ear, every single pore of their body. And with good reason, I saw the falling of the eyeball grab of these webinars. And the speakers remain the same, the content remains the same. But here is a webinar which interested me, and that's why without even batting an eyelid, I said, yes, I will. Because when Renita called up, introduced herself and said that a new council has been designed and structured under A.B. Shetty, and Krishna, of course, endorsed it and gave that final push. There's no way I'm going to say no. Yes, it meant that I needed to dig deep and come up with some nuggets of information, which hopefully I have to interest the audience. Because this is a topic, I would say, a burning issue. But then when burning issues get burnt at both the ends, there's hardly anything left. You need to be careful when you put across information filtered from whatever we have available from our resources. I would like to, at the outset, place on records my sincere appreciation for all who are responsible to put this webinar together, starting from Renita, going on to thank my dear friend Krishna Naik, and the wonderful words spoken by our Honorable Vice Chancellor, and all who are involved with this enterprise and endeavor. It gives me immense pleasure to be part of this program. Needless to say, I'm only a call away. If there's anything required, not only after this webinar, even otherwise, I will mostly be associated with this activity. So let me just go ahead and share my screen and begin my presentation. This may take a few minutes. Let me see how I can. Okay. Yes. Please tell me if you can see the screen. Can you?
Not yet, sir.
I can see it. You?
Yeah, it's presenting now.
Okay. So there's a lag, I understand.
Yeah. Yes, sir. We can see the slides now.
Is there a lag in my audio as well?
A little bit, sir.
Okay. Can I proceed?
Yes, sir, you can.
May I proceed?
Yes, sir.
May I proceed? Okay.
Yes, Kumar. Please go ahead.
I always, when I make a presentation, I bow down to my dear parents, and that's what I would like to do today as well. So let's begin with a disclaimer, because it's extremely important to place some caveats. And if you look at this disclaimer, it says that the contents result of rejigging all available data, philosophies and phrases from GNW and University, Google and WhatsApp, and any comparison could be purely coincidental and detrimental to your understanding. Because an abstract topic like this, you have to look at all the resources, the journals, the articles, publications, and pick up whatever could be relevant. That's the reason I thought I should place this disclaimer before I begin. If you look at the triad of challenge, what exactly is placed on the table? You have health, you have education, and you have technology. And belonging to the health sector, I have placed that at the apex. So if we need to reach there and be an inseparable component, or to make oral care, oral health an inseparable component of general systemic health, we need to take the help of education and technology. Because if we were to separate, we will never achieve what we want to. All goals related to optimum health care is governed by many verticals, and it all begins with education. And thanks to the era that we are in today, we cannot stay away or go far from technology. We will have to grab technology, whatever is available to us, and use them to go ahead and achieve the goal of optimum health care. If you look at the health at the apex, it involves the recipient or the beneficiary. Yeah.
So I think the slides are freezed. We are not being able to see. We can see only the first slide.
Okay. Is this the slide? What are you seeing now? Are you seeing?
Yeah, the first photograph slide, sir, of your parents.
It has not gone ahead, is it?
No, sir.
Okay, there seems to be an issue here. Get back. What do you see now?
The same photograph, sir.
Okay, is it moving now?
No, sir.
It's not moving?
No, sir. Yeah, we can see the second slide, the disclaimer now.
Do I go back? Oh, you can see it now?
Yeah, the disclaimer slide, sir. Slideshow.
Yeah. Can you see it now?
Sir, yeah, the disclaimer slide, sir.
Now what is what are you seeing now?
The same disclaimer slide.
Because I have gone ahead to the next slide. You can't see that?
No, sir.
Seems to be a huge lag. Let me just hold on. Just hold on.
Yes, sir.
Let me just let me just
Now it is moving, no? Now it is moving. He has to click on the right side. Now it is moving.
Yes, sir. We are on the third slide now. Triad of challenge.
yeah, no, I'm just yeah. I'm just trying to see if we can get to a fast.
Renita, then he can actually increase the slide size, Renita. We can advise him either the slide bar or the presentation mode because it's not clear, no? It's a very small.
Slide.
This
Slide bar.
no, the slideshow I think has to be clicked.
Yes,
the slideshow.
yes.
Yeah, he has to go on clicking the slides on the left side. Then it will shift.
No, instead of that, the slideshow button can be clicked.
Yeah,
Yes,
that will
yes.
make it bigger. And if it is not working, sometimes it does not work. He has to increase that bar in the slide bar in the right hand corner down there. Anyway, I mean, sir should will be making it. I'm just telling just how you can increase. Yeah.
Can you hear me now?
Yes, sir, we can hear you.
Okay, now let's see if the PPT works.
Yes, sir.
I guess the connection was an issue. I hope there's no lag now. Let's see. There's nothing coming on the screen yet, right? Yeah, there is. Do you have it on the screen now?
Yes, sir. Can you please click on the slideshow, sir?
It is on the screen.
Yes, sir. I mean, I can see the slide, but it's not in the slideshow mode yet.
What do you see now on the screen?
Third slide, sir.
What do you see on the screen now?
Third slide, sir.
Really? Okay, at my end it is showing. That's why I'm wondering. Okay. You want me to go back and see? Yeah, it is. There seems to be a lot of lag or something.
The slideshow, if you could click, sir, we could get a
Yeah.
better picture of the slides. Now it's seen as a small slide.
It shouldn't take so long to load the PPT, no? I know, just trying, because I can't even see myself, I can't even see anybody. So I'm wondering what's happened to the screen.
Yes, sir.
Okay. Now can you see?
Yes, sir.
Can you see now?
No, sir.
So what do I put on? Just repeat a part of what I mentioned. When you speak about health at the apex, it needs to have a strong base to reach optimum health care. And I would very much like oral health care not to be separated from systemic or general health. For too long, it has remained a separate entity. Partly our fault. When I say our fault, I'm talking about our own fraternity, and partly the system, because there cannot be a separation. That's where an integral part of general health education has to be dental health. And at the same time, when you talk about oral health or dentistry, it has to be strongly aligned to the education of general health and related allied fields. We'll talk about it. We cannot reach there without structuring education, and I'm glad that it is being revamped. A new model is being developed. I only hope that we don't commit the same errors which became blunders related to what should be taught, how it should be taught, how it should be learned, how it should be practiced, and how it should be, most importantly, ethical. To achieve all of these, whatever I just mentioned, we obviously have to fall back on technology. Technology, as we understand, has its own limitations, not in the scope of implementation, but in the scope of understanding. We also understand the limited life of technology today. I mean, needless to give numerous mentions like your model of phone, mobile phones, or software, or anything that you are using today becomes obsolete in the next 4 or 5 years, if not earlier. Keeping all these things in mind, one thing is to be clearly understood, and that is health cannot, should not be compromised at any cost. Well, I believe, and we have been taught and trained by parents and teachers alike, that if you're healthy, nothing is impossible. And if you are suboptimal in health, there's a lot of compromise and you cannot achieve what you set out to. Did the slide move now, Renita?
Yes, sir.
It's moving? Yeah.
No, sir, we are still on the third slide.
Okay. So which means once I move, I'll have to check with you before I start talking, because otherwise we'll probably lose the trail. Tell me the
Yes.
moment it
Yes.
is moved.
Yes, sir.
Has it moved?
No, not yet.
Oh, not yet.
No.
Okay. You think if I'm in that earlier mode, it will help you to see the slides, or this is better, or what do we do?
Sir, we can't see the full slideshow yet, as of now.
So what are you seeing now?
It's the third slide, sir. Tired of challenge.
Yeah, but on the slideshow, or
No,
what?
not on the slideshow, sir.
Oh yeah, there's something wrong.
Sir, if you could just mail it to Renita, maybe she can do it from this end and you can just
Yes,
speak
sir.
about it. Renita, why don't you just look into that aspect?
Yes, ma'am. Yes, ma'am.
Yeah.
So, is it possible for you to mail the PPT to me?
Let me just see. Let me just get out of this. Let me stop sharing first.
Yes. Yes.
Okay. Oh, this is such an embarrassment. Sorry.
No, sir. It's fine.
No, so with Zoom, I had my reservation about Google Meet. So probably, I don't know. It could be a genuine Yeah, thank you. Good. Let's hope this works now. Can I proceed?
Yes, sir. You can proceed.
Okay. So is there any lag now that I'm speaking, or you still think I need to slow down my speech?
No lag, sir.
Okay, good. So continuing from where I thought I was, talking about the need to achieve optimum health based on education and technology, we must understand that as healthcare providers, we need to reach the end beneficiary, which is all of us. Whether you take a vertical step down or you take a pan-India approach, we need to reach that body, that mouth, which is suboptimal in health. And at some point in time, everybody will need our efforts. How to make it easy, how to reach everybody, that truly is the challenge. So let's see, in an effort and endeavor to reach there, what can we do, or what we should be doing. Yeah, next please. So where are we? We need to, for anything, for any enterprise, we first need to understand where are we. We are currently at the crossroads of growth and development. Yeah, it may sound like a very orthodontic approach when you talk about growth. Yeah, just wait for this thing, yeah? Command, Renita. Let me finish one bullet.
Yes, yes.
Yeah. So when you talk about growth and development, it's extremely important to understand as to once we reach a designated growth level, we need to then develop horizontally or laterally. Once we achieve optimal development, we then go to the next level of growth. Invariably, what happens if we get these two mixed up? We are not completely mature in the stage that we need to. I may be sounding very abstract here. Let me qualify it. For example, why do we take 1 year to finish an academic year? Once we enter the first month of the academic year, it's a matter of getting exposed and acclimatized. And then once we understand that, we need to look at the subjects. We need to look at what is in that subject it's going to make a difference to our understanding, knowledge. So it takes 1 full year to laterally grow in that year, achieve reasonable level of expertise. That's when you are ready for the higher level of growth. That's how we go to the second year, third year, final year, and thereon. Development has to happen within and externally. Similarly, I will correlate this particular philosophy to our understanding of how we go further. Next bullet, please. Yeah. Now, what has also done is it has placed us at the horns of a dilemma. As human beings, we want to be in control. That means we want to govern. We also must understand that when there has to be a difference between governance and administration, it is not the question of ruling. Whatever I say has to be adhered to. The moment we get into that, then it becomes unilinear and you're always waiting for the command to perform. And that is never healthy. You need to develop your own sense of self and administer, because we cannot remain isolated. We cannot live in silos. We have to stay connected, form small teams, get the confidence of the team members, a two-way process. It takes time for team building. That's the reason why I said we are actually currently a bit confused whether we should be administering, which is a two-way process, or governing. So you will say at times we need to govern, and I wouldn't differ from that. But the maturity as to who and to how much that you need to be heard and ruled, again, is a matter of learning. Next, please. So, if you again look around us, we are vacillating between deficiency and excess. You take any field for that matter. When I was in dental college, there were 15 colleges all over the country, and the powers that be thought that we needed more colleges. Probably yes. And then there were a surfeit of colleges, and today we have 300 plus. So we went from a deficient stage to an excess stage. Now what did that do? Probably compromised on the quality, probably. I'm no judge to say whether we should be having so many dental colleges. What we need is quality education, and we need to only look within. This is no blame game. So if we are looking at innovation, which is the goal of this topic today, and the mission of this council under A.B. Shetty, we need to analyze, study as to how much is the shortfall, what do we need to do to reach optimum, and this is where the planning comes. Are we planning for a good 20 years ahead? If we are, then probably it will be sensible. The tendency is, let's work and plan. An example, a case in point, are the bridges and the highways. I'm sure, I remember a bridge that we crossed from Mangalore city to go to Delakatte. And I don't know whether the bridge is now widened, but there used to be a time when it used to be so narrow and the vehicle had to stop for the opposite vehicle. And I was wondering, whenever the bridge was planned, why wasn't it planned for 4-lane each way? It's very easy to say, maybe the funding could be an issue, but let us plan for long, because today times get fast forwarded faster. Whether it's in Mumbai, today we're having a challenge of a new airport being designed. It's not the challenge of the airport, but the challenge of the reach to the airport via roads and highways. So that's where, if we are planning, let's plan. Even as of today, it may sound like an excess, but in a short period of time, that will become adequate. Let's move ahead. Now, this is exactly what we are facing today. We are battling sense with science. We know that science is not black or white. There is no gray, or there shouldn't be any gray. But can't be said the same thing about sense. The rationalist and the not so rational will always have a battle. How scientific can you get? And it is something which is called as a spiritual side to it, or the metaphysical attached to it. This is where there are lobbies, and in innovation, we are going to be faced with these challenges. There are going to be lobbies who are going to challenge your reasoning, your science, and in science, we always need to back it up with a good amount of justification and logic. That's why I remember in school, I think in primary school or even in middle school, there used to be give scientific reasons for. And that made sure that people didn't come up with smart answers. It had to be scientific. So we need to always balance science with common sense, with the deliverables, and then proceed further. And this is extremely important when you're talking about innovation. You can come up with an idea, and we all say that no idea is stupid. But every great invention started with a stupid idea or with an idea. But to just about be flippant in throwing up an idea doesn't help. We need to back it up with science. Let's go ahead. So what do we need? We need simple and practical SOPs. The standard operating procedures needn't be lengthy and needn't be complicated. Because if at all we think we need to reach a particular destination, and the process in reaching the destination is so complicated, we get tired, we get disinterested, and the entire idea falls by the wayside. That's the reason why, in case you think about an idea, think about simple steps to reach there. If you think that you cannot reach in simple steps, then make junctions or destinations. Like I'm sure you have certain stops that you take when you want to go to a particular destination or a place. And in your journey, you take breaks. Why do you take a break? So that you rejuvenate, refresh, re-energize, get into your vehicle, drive further, next junction. Though you know the journey is long. Similarly, in your journey towards innovation and ideas, make junctions. What I remember when I was in school, in a subject called civics and administration, something was introduced to us called 5-year plans. Well, at that time, the government came up with 5-year plans. So you planned for 5 years, you started working towards it, and towards the end of the 3rd year, you know that you're going to achieve it, or you're going to fall short, plan for the next 5 years. Similarly, your SOPs have to be simple to reach the next logical destination. Next, please. I'm so glad that in the opening address, our Honorable Vice Chancellor mentioned about affordability of treatment, because the treatment that they are set in stone as far as science is concerned has to be made affordable. That certainly is in our realms. One would say, and I would recall the great Dr. Shetty mentioning that it's not important to come up with solutions to health problems. It's important to also go further and make it affordable. It's very easily said, and one always has a charitable side to each one of us. We all have that. How logical and how sustainable. Like, for example, you set up an institute and you call it Charitable Institute. In that Charitable Institute, you have certain treatment which you can go ahead and give, or you promise the patients. Can it be done continuously? You may have a bag of goodies to give today, but we are interested in ensuring that over long periods of time, those goodies are shared or made available for maximum number of people for the longest period of time. That is sustainability. So it is not only affordable, but it has to be sustainable. So when you develop protocols for your innovation, make sure that they're sustainable, apart from being affordable. Next, please. This to me is extremely important. I know of my friends and colleagues, I know of my students, I know even now when there's a lot of talent, there's a lot of local talent. Why isn't it coming up? The reason being language barriers. Yes, I understand that today, globally, English is the accepted language and it gives you a push for sure. And I have seen many students struggle the time that they finish their 10th and 12th and get into professional colleges, and the huge issue of insecurity, fear, and lack of reaching out because they remain very restricted and they don't come out openly because they start getting compared to a fluently spoken English language colleague or student. Though, mind you, he could be more intelligent, he could have more resources, but the challenge of the barrier of a language keeps him away. So I strongly advocate, if people who are into policy making come up with what we call as local/colloquial language curriculum in dental colleges, you will then see a huge spurt of creative talent emerge from this lobby of students who are finding it difficult to relate and to communicate with not only their colleagues but even the teachers and the faculty. So I think Kannada language, all languages, is replete with meanings, with comparative terminologies. You can even go ahead and develop, that itself can be innovation. And that itself can be taken up by the council at Shetty, that come up with a curriculum in dentistry in Kannada. And my parents used to tell me the purest form of Kannada was spoken in Dakshin Kannada or Mangaluru. So why not? So maybe we can take the lead and come up with this. And I don't think it will be a huge challenge to influence the dental council to adopt local language. That itself will throw up a lot of employment and excitement related to coming up with the curriculum in local languages. And why not? Because if Brazil today is having extremely high number of publications and most of their things is in Spanish or in European languages in German, then why not? What's wrong? Yes, we could have publications in Bengali, in Kannada, in Tamil, or Hindi, of course, I understand, largely spoken by about, say, 7 or 8 or 10 states. But these are the languages that we need to come up with the curriculum and make it easy. I'm sure it will bring up a completely new facet to our learning. Next, please. Now, what happens is in science and in dentistry as well, there are certain formulae, there are certain codes. I think once we come up with this local language thing, they can all be reproducible. Even when you're into innovations, make sure that your codes and formulae are not only relevant to you and your understanding, it has to be easily reproducible. What's the motive? The motive is not that you or the founder of a particular innovation should be the only legend and great. If you look at all great men, they started within, but they shared with the world. So have an open mind where your codes and formulae can be reproduced. Next. So let's continue and see what is a wish list in what we need. Yeah. So I briefly touched upon restructuring the education modules. This is not a job of one single person. However, we can contribute. I'll give you a small example. There is something called a dental chairside assistant course. There wasn't such a course available. So I went ahead and I structured a blueprint for such a course called dental chairside assistant. Now, whom do I go to? Somebody has to conduct it, right? So I was fortunate to meet the Dean of Tata Institute of Social Sciences. And this was much before the skill ministry came up with this skilling program certification, much before that. So I didn't know which door to knock, so I went and met him. I said, this is what I have, because what I have realized in my experience in my clinic is that we have untrained people joining in, and just because they have worked with us over a period of time, they have developed some skills, but we need to structure it. It will open up a new vista. So he was happy, and we ran a course. At that time, there was no certification, but later on it led to a certification. I went ahead and shared with another health university, the ITM group of institutions. They were happy. So we are running courses now. And then, as luck would have it, the Skill University came up and included this as part of their course. The point I'm trying to drive is not because I came up with it. The point is, we need to constantly look at restructuring the education. I don't intend to convey that every 2-3 years keep changing it, that will become a big mess. We need to have a review system. Seldom do we have a review into what we are teaching. Unless and until there's review, there is no scope for renew. And if there's no renew, everything becomes hashed and old system of learning. So you would turn around and ask me, we know that the education system in the United States of America, as far as dentistry is concerned, is rock solid. So what has changed there? A lot has changed, my friends. The way they used to teach 50 years ago, the way they teach today, and they're always looking at innovating. And that's why they still remain the most progressive country. Even in dentistry, I strongly believe this. And when I give the lecture on what after BDs, I would tell the students and the interns that dentistry is the most progressive and the most contemporary taught and learnt in the US of A. Yes, we can simulate the model. Why not? Are we? Should we be? Yes, we should. I'm not saying clone or copy. Indigenize it. Take that philosophy, indigenize it. And at some point in time, I would go ahead and spend more time in explaining how do we indigenize a thought process or a teaching module related to dentistry in our country, in our environment. That's what I mean by restructuring the education modules. Next, please. I mentioned about the skill-oriented courses. Dental chairside assistant was only one of it. There could be many allied courses in the field of dentistry where we can have certification. For example, what stops us from creating a small certificate program for the dental front office manager? Let's not call it secretary, because there's a whole lot of responsibility on that person. Just to highlight one or two, the phone calls of a patient who has not yet visited your practices. How is that patient greeted? The first visit, the registration details, the counseling, the fee collection. There can be a small certification program for the front office of dental clinics. And that in itself will create employment. That in itself create a new breed. We don't have to look elsewhere to train a person. We will get a ready-made trained person, and they can only take the practice higher and smoother. So skill-oriented courses, I think, are the need of the day. The next will be a back office. When we finish treatment, the instruments which are to be collected from the chair side, taken to the back office, run through the routines of wash, rinse, pack, autoclave, unpack. That itself can be another skill program. So that will create a trained person, because as I see, a dental clinic in the next 10 years will be a completely new setup and team. It is not the dentist is only one small, I repeat, a small member of that team. You will have trained personnel, and you no longer will have one chair clinics, because I am confident the affordability will increase and improve, and you will have at least 2 or 3, because that's what the need is. Once the people are aware that they need treatment, and once we make a structure, and I'll come to the insurance aspect as well, affordable, you'll have more people, you need more people, you need smoother operations. That's why the skill-oriented courses are extremely essential. Next, please. Which will then leave the dentist to think beyond fee collection, accounting, taxations. His core knowledge, today we want dentists to be everything. No, let him stick to core knowledge. He'll create a task force creation with medical specialists. He'll have focused outreach programs. He will reach out to the end beneficiary, explain to him, convince him about what treatment. So that is what he's trained for. What he has picked up, because of no option, is to also learn to clean, pack, autoclave. That you can leave aside to an associate or a trained assistant. So we need to focus on the task force creation of specialists to go ahead and enhance the scope of oral health care. We need to also look at, for example, today, whatever material we get on the shelf, we use it. For a moment, we must, oh, can I get this? How would I would have felt so nice if I had something better. Am I working to see what is better? There's no time. So this will allow us to think about improving materials and equipments. Next, please. You know, it's such a coincidence that when I had prepared this slide, and Renata sent me a message saying that, Doctor, it would be nice if you can also include entrepreneurship and IP rights. Coincidentally, I had already included it, but it helped me to sort of read more into it. So let me address this in a bit of a detail. When we are talking about undergraduate students, interns, and postgraduate students, we must understand that most of this burning, the appetite, the hunger is at that age between 20 to 30 to 35. Once we advance in age, we sit back on a cushion called experience. And when the cushion is comfortable, the mind doesn't think hard. It's only when you're sitting on thorns and you're walking on rubble and stones that your mind thinks, how can I make my journey smoother? Similarly, entrepreneurship, intellectual property rights, it's a huge thing because I have known a few of our Indian undergrad students. They think brilliantly. They need somebody to hold their hand and somebody where we can go ahead and harness all that energy and help them to come up with brilliant ideas. The fear that the student has, and they're shared with me, and they're, I think, to a large extent, justified. They said that, Doc, when you come up with an idea, what is the guarantee that it won't be taken away, stolen away, and I won't be given the credit? It's very human to feel insecure, very human. So if there is a team, and if the idea is coming up with the junior most member of that team, allow him to speak, reassure him that he will be given due credit. And you will see a whole lot of these ideas emerge. It can be a first BDS student, it could be an intern. At any level, we need to encourage them to come up with ideas and also promise them that you will handhold them and take it to the logical conclusion and they may become entrepreneurs. I'll give you a small example again. I did my postgraduate diploma in hospital and healthcare management around 12, 13 years ago. Why did I feel the need to? I thought that we need to come up with some sort of a structure to this abstract, what is called as practice management. So when I did that course, as part of the course, we had to submit a project report. And the project report that I chose at that time was corporate chain of dental clinics. Yes, ladies and gentlemen, there was no corporate chain of clinics at that time, none whatsoever. So I just thought I put together a project as to if a corporate were to run chain of dental clinics, how would it be? What would be the personnel? What would be the design of the clinic, the area, the corporate structure, all those things. The moment I received my certification at the convocation, the next 2 months saw a spate of 3 corporate chain clinics in the country. Narayan Healthcare, I think it came up in Bangalore. Then there was this thing in Tamil Nadu and Andhra Pradesh. Then we had one in our own state of Maharashtra and Mumbai, especially, called My Dentist. And much years later, there's some club. So a lot of corporate clusters have come up. Again, going back to the thought that why did I think about that? It just came as an idea. I just put it as a project report. I'm not saying, please don't get me wrong. I'm not saying that I created this thought. An idea came to me. It could have been coincidental that that particular project, accepted by the university, saw its way. There are both advantages and disadvantages we know of corporate chains. But this is where we are. Similarly, entrepreneurship. If at all I had the wherewithal of finance, I probably could have gone ahead and at that stage gone to the business partners and give the plans. I didn't have the foresight, and maybe it wasn't destined. But intellectual property patenting is an extremely important step. There's a difference between secrecy and confidentiality. Secrecy, and this is my interpretation of the word, is you want to keep it within. You're very secretive about it. Confidentiality is slightly more open. You've written it down, you documented it, you probably have encrypted it so that it doesn't go out easily and get hacked. You're confidential. All these corporates, they have a clause called confidentiality clause. Because if you are at a stage, a head of marketing or head of innovation, you need to have some sort of a loyalty to the organization. Similarly, and I'm all for it, the Honorable Vice Chancellor will come up or must be already having a team and a confidentiality clause where if there's anything being discussed in the four walls through ideation or integration, then it has to remain in those four walls till an appropriate time comes when the announcement will be made. So that is a confidentiality. You need to be very particular, go through the steps involved into patenting, and once you get your patent registered, we all know that it's got a time limit when it is still a patent. It used to be 7 years. I could be standing corrected here, but the time limitation is mentioned. It's almost like, this is the expiry. After that, it becomes stale. Similarly, a patent has a period. Through that time, you need to go ahead, and if you feel it's really going to be earth-shaking, your invention or innovation, then that patent has got a limit after which everyone can clone it or they can simulate it. It no longer remains as patent. But patenting is extremely important, for which we need to understand the paperwork. There's a lot of documentation involved. There's a lot of rules, regulations, and protocols laid down. Every country has different rules, by the way. India has different rules of patenting. That's why they will say when you have a particular innovation idea, you apply for a Europe patent, you apply for a US patent, you apply for a Singapore patent, or you apply for an Indian patent. So patents rules differ from country to country. But we need to have, as far as India is concerned, the paperwork, anywhere paperwork will be there. But in India, I think the paperwork is slightly more lengthy. So we need to make it easier. And I'm sure even AB Shetty, the council will have some protocols through which they can help you to apply for a patent. Next, please. Why are we talking about all this? Because we need to make more people aware that they need oral care. It is not only when the pain arrives. Today we know there's a strong correlation between oral care and systemic health, oral health and systemic health. So we need to put this message across in a friendly manner so that the task force will be, the net will be cast wider, and everywhere and anybody in the remotest of our country should be made aware that oral care is extremely important, if not more than general health. I'm not saying this just because we are dentists and we are sort of shouting for work. We truly are interested into ensuring good, optimal oral health for all concerned, be it a child or an adolescent or a young adult or a geriatric, be it a pubertal girl, a woman who is going through pregnancy or menopause. Because we have all these end clusters of beneficiaries who we want to reach out to. And once we identify them, you can come up with an innovative program to make sure that they can reach us through a portal. What one thing this COVID has done, it has enabled an understanding of logging in to portals, logging into apps. You'll be amazed as to how almost everybody understands a CoWIN app. So why not have a DentWin app? I'm just giving it a name, a DentWin app, where anything related to dental they just have to log into the DentWin app, whether they need to know the dental colleges, whether anything related to teeth and oral care should be on an app. And I'm sure that somebody at AB Shetty will take up this idea, and I'm always available to brainstorm on this. Let's move ahead. So when you look at how do we go about towards innovation, let's look at the steps. Yeah. So first thing is observe. Just observe from morning to night. So you wake up and you know your needs, whether you're a faculty or you're a student or you're an admin person. From morning to night, what are the things that you went through and where do you think things can be made easier? Look at all those things, note it down, jot it down. So you need to have a very good sense of observation. Whether you're teaching in college or even when you're listening to me now, just observe and see, can this be better? For example, we struggled with my PowerPoint here at my end. What could have gone wrong? And thanks to technology, I could email it, and the brilliant team that Renita has, she went ahead and we're now catching up with lost time. So observe every single thing and note it down. Okay, then what do we do next? Ideate. So once you observe and you form a few things in your mind, you need to now ideate. Ideate within, ideate with your friends, ideate with your colleagues, and whatever groups that you have, all who have a progressive thought. Now, I'll tell you the challenge of ideating. The moment you ideate, oh, come on, it's very easy to just water down or just to throw away an idea. The easiest thing is to throw away an idea. But imagine if you have a group of encouraging friends or colleagues. Oh, really? Hey, this sounds interesting. Let's see. So don't just throw up an idea, back it up with what you want to do till the first junction. I've known a lot of friends who will ideate and, no, you have to be part of it. So please observe, ideate, look at the possibilities, and when you ideate, please keep one thing in mind: minimum collateral damage. I repeat, minimum collateral damage. So when you want to achieve something, you will have to let go of. But if you keep letting go of a lot of things, that's called huge collateral damage. You will end up with a very weak idea. If the idea has to become strong and to snowball into creation, you need to make sure that your collateral damages are minimal. Next. Then, when you ideate, you have to collaborate. Like, for example, an idea is born in the department of oral and oral diagnosis. I think that's Renita's department, if I am not mistaken, and radiology. So they come with an idea. They have to collaborate. How will this help? Will this help the Department of Orthodontics? Call up Dr. Krishna Naik and he'll put, okay, having spoken about orthodontics, can this also help imaging sciences and look at what it can do to the bone, to the implant surface interface? So you're now talking about surgical or periodontal department. So you need to collaborate. It need not be only in your college. It could be in the adjacent medical college. For all you care, it could be in a competing university. Like, for example, I know that we used to call it the Amar Akbar Anthony of medical colleges in Mangaluru. You had the Father Muller and the Shetty and the Yennapoya. So it could be adjacent colleges. As long as there is mutual trust and faith, you can collaborate. And collaboration can be lateral, can be oblique, can be vertical, which means that you could have it at your level, or you could have it at the national level, interstate level, international level. There are different types of collaborations. But let the collaborations just not end up on paper. I've seen a lot of universities, we are affiliated too. Good. What next? What do you all do in that affiliation? Precious little. So you need to have very clear idea as to what are the confines and what are the limitations of collaboration for this idea, because you will need a lot of lateral help for the idea to be converted into an innovation. So what do we do after collaborating? Let's see. we need to substantiate with research. You cannot loosely mention something without substantiating. So let's look at substantiating. Go ahead, write down a pilot study, take some small sample size, see how this sample size can it be extrapolated, and will the findings hold good in extrapolation, because sometimes it gets diluted and lost in extrapolation. So you need to do a lot of research, and nothing happens overnight. That's one problem with youngsters, with due respects. They are in such a tearing hurry to reach the end point that a lot of compromises happen. So that's the reason why I always encourage departmental studies, departmental groups for ideation, so that the student, PG student, may be here today and gone after 3 years, but that study goes on. Most of the times I've seen that they are in such a hurry that they want to finish it off before they leave. If I leave, then I won't get the credit. Doesn't matter. As human beings, we need to ideate, collaborate, research, and hope that the next person also continues it. And if you've contributed adequately, don't worry, credit will come your way. And if it didn't, and I take a very philosophical approach, if it didn't, it wasn't destined to. So don't dilute the involvement thinking that, oh, I'm only here for 3 years, after that I don't care. No. That's where the department research, the head of the department, becomes completely the reviewer and the researcher. And he will be in charge, and he is supposed to encourage any idea, make sure that due credit is given. Let's go ahead. Once you finish your findings, you need to illustrate. You need to publish. When I say publish, if it's in a reputed, peer-reviewed journal, very good. Or if it's not, make your research notes. Let it be in the department. So tomorrow when somebody comes in, he can take off. He doesn't have to go back and do the same thing what you've done. That's where we need to document, illustrate, document, publish all the findings, and they're very valuable. And gladly today, we have enough of digital records which you can keep, so you don't need space. But we need to have enough of illustration, publications, and documentations related to all our findings. Yeah. Once we have done this, you need to communicate with the relevant authorities, be it a patent office, or be it a scientific organization where you have to submit your data for approvals. It could be an industry partner. It could be a research organization like the BARC or the IITs, or your Institute of Science in Bengaluru, or any of, or meteorological, it could be anything to do with weather. So all these organizations, you need to reach out to them. Again, there definitely will be a confidentiality element involved with it. And let me tell you one more thing. If things have to leak, they will. You can do your best of keeping them sealed. But just because we know that it's going to be, then why do we want to bother much about confidentiality? No, we need to have, it's relevant that you need to be a very structured confidentiality with the corresponding organization. But you need to communicate well, whoever could be your other collaborating partner. Sometimes what happens is your collaborating partner may feel cheated. That, oh, you didn't tell me this before. Oh, is this the finding? No, I don't think this complies with our... So at every stage, make sure that if he is a collaborating partner, he's also aware and he's on the same page. Because, you know, human natures and their frailties. So why wasn't I told this before? I should have known. So just, it's always good to reasonably pamper egos and to achieve your goals. Next. So what can be done? Let's have a look at what can be done. Global collaboration. So I mentioned it. with local impetus on research. Now, for the first time in today's lecture, I'm mentioning about the Ayurveda, or could be the Unani. I'm talking about native medicines. There's a huge potential for native medicines. Most of the times, it gets lost out because there is no strong research protocol that can be respected by international scientific community. That is the challenge. So we need to come up with good research protocols using our products, native products, and then making sure that these products, when used, achieve certain outcomes. And these outcomes are similar, if not better, than the traditional conventional approach. So whether you take a contemporary global medicine, it could be a topical. Let's take a case in, when I was doing my PG in perio, there was a topical application, an Ayurvedic product, which was supposed to have good control over erosive lesions. We all know that erosive lesions in postmenopausal women is so common, and it is a very uncomfortable scenario for the patient. So this postgraduate student used it. He did whatever sample size study he had to do, and at the exam, one of the examiners probably didn't align with the thought of an Ayurvedic product being used as a topical, and he was grilled and grilled and grilled. Why? The simple reason that it did not have a global patent for sure. It also did not align with the global scientific research protocols. I'm not saying the product is bad. I'm not saying the ingredient is not to the expectation. Because there are no codes, there are no research by which we can go ahead and project it and compare apples with apples when it comes to treatment outcomes, we're lagging. So an innovation could be where we come up with a template where any product can fit in. This is how it should be studied and presented. You all know that in these COVID times, the role of kada, and we all know how kada is prepared. Our grandmothers gave it to us, didn't she? But today, it's accepted worldwide as one of the remedial measures for COVID and to keep the symptoms at bay. So have we lost out on that? I think we did to a fair extent. So let us not lose out and come up with some good apps and good templates and protocols to make sure that all our indigenous products will also be compared and probably rule the roost as far as the international market or community is concerned. Next. This is where I would like all authorities of colleges, vice chancellors, deans, the scientific heads to incentivize and encourage. When I say incentivize, it doesn't have to be financial. We have to find ways and means of encouraging our undergraduate students, our interns, our PGs. You know, what happens is, to an extent, we understand their needs and we think we know it all. But when they have come in, like for example, if they have come in from a vernacular medium and entered into a dental college, we want to make them feel comfortable. So let's make them sit, talk to them after about 6 or 8 months, or maybe even at the end of 1 year. What are the difficulties they faced? So that the next batch, we will make those tweaks, we'll make those improvisations in our systems. So next batch is more comfortable. And if a UG has an idea, let's listen to him. So let's have these camps, and I'm sure the Honorable Vice Chancellor did mention about these ideation camps. That will help to bring out beautiful ideas. Interns, what was their difficulties in the first 4 years that they went through? What is it that they would recommend as an improvement? Let's listen to them and possibly incorporate if possible. The same thing holds good for PGs. Why is it important? When it comes to PGs, those departments, specific departments, improvements in material, they're doing the research, they're doing a 2-year study or 1-year study or 6-month study. But let it be a department study where they're part of it. It is not only for them. So a long-standing, let's say a long-running 2 years, 3 years, 4 years study, coming up with some material research will help, or could be some techniques as well. So this is where we can start our innovation plans in colleges. Next. We spoke briefly about the skill certification programs and the fellowships. A lot of universities have started fellowships, but for some strange reason, they have not met with success and they have dropped it after a year or two. Maybe the expectation of the clinician, but most of the fellowship programs are clinical programs. They have fallen short by way of the course curriculum or what we call as recognition. So the council has to also go back and loosen their thoughts into making the fellowships acceptable and recognized by the state dental councils. The issue, I think, is between academicians and clinicians. If a fellowship program is completely a clinical program, their claim to start getting teaching positions is an issue that can be sorted out. It's not at all difficult. But keeping that as a stumbling block and not encouraging fellowship programs, I don't think is the solution. I'm sure wiser counsel will prevail and we will come up with some innovative ideas, because these fellowship programs can go a long way into improving the confidence of the clinician, which in turn will rub off on the patients. So short skill certification programs for the auxiliaries and fellowship programs for the clinicians, I think, way to go forward. Exchange programs. Now, in the past, exchange programs were taken more as a picnic. I'm sorry to say. We need to have structured exchange programs with due credits given to the students and faculty, which will make it very helpful. We ran a small skeletal program in Maharashtra with good success. As part of internship, they had to choose between a 15-day exposure within the state and a 15-day outside the state, just to understand the patient psyche. Because tomorrow that particular intern graduating from your institution can go and settle down in the other end of the country. So he needs to understand patient psyche in our country differs, like everywhere. The local language could be an issue. The local flavor and thinking can be different. So to enable all of that, we thought to expose this student or this intern during internship for a 2-week program, and it worked out very well. So maybe an app can be created. It will make them very easy as to where is it available, where he can choose. And I don't think the costing is a major issue. That's a very minor issue. For somebody who, and also the moment you make anything mandatory, compulsory, it forces somebody to duck the law. What I would encourage is give credits rather than making mandatory. If you do this, you can get this as well. Maybe a certificate or something, because you need to give some credit, incentivize it, and that's when they will not try to evade or avoid going there. Yeah. So exchange program. For faculty, again, it's very interesting because somebody who is, and I know a lot of Mangalore graduated, postgraduate students have settled down in North. That was the era when colleges started in Rajasthan and UP, in Madhya Pradesh, and a lot of our graduates, our postgraduates have gone and settled there, and they have reached the highest of positions of professors and deans and principals. So for faculty also, it's a good idea to encourage exchange programs. They can come back with an idea, and that can become an idea for a new innovation. I would strongly recommend that. And also to spend time in basic science research centers. For example, in BRC or in IITs, let them spend some time. Once they reach a particular idea, how do we now go ahead and collaborate with these institutes? Is there anything in basic science that I need to understand and learn? So even at the basic science research centers, they can spend some time, the faculty and the interns. Next, please. So let's go on to see what should be done now. Yeah. Fund allocation. We always do. We need money for all. Ideas can come and go, but how do we implement it? If we make fund as our main problem, we'll never go further. There are ways of circumventing it. And I know, for example, an innovation idea of banking. It all started from Manipal, didn't it? Years ago. At that time, they thought that the banking sector, the banking industry, the banking philosophy, it all started from Manipal. So why can't something start from maybe Shetty, Mangaluru, or any of the colleges? We need to have faith in the PPP model, the public-private partnership model. There could be a venture capitalist or a group of venture capitalists who could be interested in a particular idea and innovation, collaborate with them. The funds can come in over a period of time. What really saddened me was to understand that Maharashtra University of Health Sciences has allotted funds for every institution towards research. And I was shocked to learn that for 7 consecutive years, only 10% of the funds were utilized. And I believe it's the same at the UGC level, at the ICMR level. They all have funds available, but it's not utilized. And even if it is utilized, it is not in the manner of the outcome which was envisaged. So we need to be a bit more truthful and more faithful to the claims of these funds. Funds are available, my friends. It's a matter of how we present to these people and to get those funds and to utilize the funds in a very, very positive manner. Next. Now, this is very interesting, and I hope somebody takes it up. I strongly feel there is room and place for a creation of an MBA in oral health. I repeat, we have got MBA in health, no, MBA in oral health. There's so much to be done in oral health. You have good amount. I would be very happy to develop a curriculum to help somebody to start an MBA in oral health. And it will be a good course to have because our industry partners, our pharma companies, they will all look for these MBAs. At the end of the day, they also want to understand the market that is currently there. So come up with a MBA curriculum in oral health. If you want to start with a diploma, so be it. Start a diploma, a 1-year program. But we need to have a structured program for oral health. Next. We need to have a joint cell of the academic and industry partners. See, what happens is, as academia, we keep thinking about the benefits of health and not necessarily looking at the problems of implementation. The industry partner, let's say, for example, if we innovate equipment, a robotic equipment, where the patient is sitting on a chair and is clamped, the clamp is raised, and imaging science, an X-ray is taken or a CBCT is taken, the industry partner will always look at how much is the investment and how much is the ROI, return of investment. It's also looking at the marketing as to what is the scope of how many equipments can I sell in a particular year, and is it easy to maintain it? Is it easy that the next model will come? All those issues, the industry partner thinks. It's a good idea to have a team of industry partner so that we come up with good indigenous materials of use that we have day to day, and of course the equipment and instruments, hand instruments as well. So a joint cell will be very, very helpful, and industry partners always help. I was part of a cell called ethical advertisements, and at that moment in time, Colgate nominated me on this particular cell. It was called as Advertisement Standard Council of India, ASCI. The job was to pull up frivolous advertisers who promised huge things, which are not true, not scientifically true. So what I realized then sitting in that board was that the industry thinks differently. the scientists think differently, and the twain seldom meet. So we need to create a positive atmosphere by having this joint cell. Yeah. Innovation conclaves. I would love A.B. Shetty Council, IC, to initiate to host a pan-India. Today it's easy, sitting in our bedrooms, in our pajamas, we can be part of a conclave. So the costing of travel and hosting can be minimized. At the same time, we can have a very high level of discussion on this innovation conclaves. And I know that a lot of people will not open up on this conclaves because there's a element of secrecy or confidentiality, but at least it will throw up the way of thinking of us Indians. If the main mudda or mission can be how do we portray dentistry in an indigenous model, I think ideas can come up. So an innovation conclave is something which I would strongly propose. Next. So let's look at how these will all meet. We spoke about the mission statement. Every institute, every council needs to have a mission statement. A mission statement is very broad-based. It cannot be very narrow, very broad-based. What should it be? The fulfillment of the need for oral health by the Indian population, something like that. So then we know we're all working towards it. There has to be an end goal. Next, please. It has to be time-bound. We can't keep it, indefinite. This is what happens most of the times. Today, we're all energized. We're excited. We have this webinar. Okay. Till the next webinar, probably, this excitement and very logically will abate. So what I used to do when I used to teach in college in Kharghar here was that if there's a good meeting, a good brainstorming meeting, there has to be a time bound. Before next 2 weeks, I want feedback. Once the feedback is, then make that into a template. So keep having your time bound plans. That's the only way you will keep the flame burning. Otherwise, it will be on the back burner, like most of our plans and ideas. So time bound plans are extremely important. Next. I mentioned about reasonability in goals. It can't be a very hi-fi idea, and because it has to always hinge on the feasibility and the financial viability. So if the plan is executed today, how soon can we have the results of the outcomes, and how much would it cost? What's called as a project cost. Every idea should have a project cost. Obviously, someone in the task force should be given the duty of finding out from where would the funds come. At the same time, somebody who's giving an idea also should think about that. I tell this to my team in the clinic. As when we have a discussion, you can come up with a problem, but please also come up with at least 2 solutions. They may not be practical, but come up with a solution. I don't want people to become armchair critics. It's very easy to rock in your armchair and this is not right, that is not right, or this should have been done, that should have been done. So that can't happen. So we need to always look at whether we are looking at the feasibility and the financial viability. Next. Now this is a bit of a challenge. We are glad that we're having a webinar hosted by A.B. Shetty, and very close to your colleges, we have a member of parliament. So if we have a dentist in that parliament, I'm sure we need to align and you actually go to him to make sure that there's some reasonable element of priority given to oral health sector. One MP may not make the difference, but he can influence. And this is where we need to look at influencers. And we also have legends in A.B. Shetty in the past who have been heading the council, like Professor Shetty. We have Krishna Nayak who was the council. So if we can align with positive-minded people, dentists, could be at the respective legislative councils or assemblies. There could be an MLA or an MP. We need to, it's time now that we speak as one voice and be heard, because it is not the question of me too. It's a question of being there at the right time with the right ideas. So let's look at being there, making our presence felt. Yeah, next. So let's look at the crutches of AIDS, as I call it. And this is a message to the youngsters. You must have mentors. You must have mentors, because it's the experience of the mentors, it's the vision of the mentors which is going to help you to reach your goal in the shortest of times. And mentors, I can speak on behalf of all of them. We are all very, very large-hearted, and we love youngsters with ideas. So please, without any hesitation, you can call on any mentor, and he will lend his expertise and wisdom, which will make it easier for you to execute your ideas. We need to have an umbrella of the academia. You need to have a university, you need to have a college, you need to have a huge research organization, because ideas cannot be delivered single-handedly. You need an institution. And globally, I mean, gone are the days of garage research. We used to call them garage research. But today we need an institution, a recognized institution, where it will lend credibility to your ideas and studies. We spoke about the funding and the funders. There are ample available, but they need to be convinced as to their funding is going to be well utilized. You know, we keep reading about the Bill Gates Foundation and the Clinton Foundation. These are all fund. You think there are less foundations in India? There are a lot of Indian funders available. The problem is they're not convinced about the utilization. So they will be available. They're listed by the Reserve Bank. They're listed by the UGC and the ICMR. We need to walk their talk and make sure that we utilize their funding properly. We spoke about the research organization. You also need to always align with the research organization. It could be a field market survey research organization. It could be a basic science research organization. But your study, your idea has to have the label of a research organization affiliation. Needless to say that all the figures that you draw up, all the data that you draw up needs to be analyzed, and statisticians will come to play and make sure that those figures are significant when it is ultimately reaching a publication or a population. Yeah, let's see the last slide now. So what would I call as a magic mantra? You need to ideate. When I say you, anybody in the team or individual need to ideate. Once they ideate, next, we need to initiate. You can't sit with an idea, you need to initiate. To initiate, you need to understand as to now whom do I go with this idea to? To my senior, to my colleague, to my friend, to a research organization, to an industry partner. So you need to initiate the thought. Next. And once you have identified your potential partners, you need to integrate them. You need to ensure that all of you are on the same page with the same positive attitude. And you also know of what are the pitfalls and where you could find challenges. That's where you integrate. So you ideate, you initiate, you integrate, and then you, of course, you innovate. Next. So this is where I thought it will make it easy for us to understand what is needed towards innovation. I think I have just scratched the surface of today's topic. And if we do all of this, the next slide is what should have been the title slide. Next. I thought let me bring it at the end. If we do all of this, I'm sure we can and we will. Next slide and the final slide is, of course, as always, a thank you slide. And I've really enjoyed speaking to you this morning. I apologize for all the technical glitches that we had, but hopefully we've had a wonderful interaction. Thank you so much. Thank you.
Thank you, sir, for the informative and the interesting talk, and also for giving us new ideas and suggestions. So I have just one question to you. Do you think we should include the concept of IPR in the dental curriculum?
The moment we speak about IPR, a lot of regulatory organizations will get drawn in. For example, the patent ministries, the HR, Ministry of HR, all of those will come in, and they will have, of course, their rules and regulations. But we must at least start thinking on those lines, because for the fear of my idea being stolen, I keep the idea to myself, which is very damaging and self-limiting. So if at all we think of going further and going wider, then I think the IPR being part of the dental curriculum should be helpful. During our time, there should be something called as optional credits. So let us start off by having them as optional credits. Optional credits means that you take these classes, you appear for evaluation or assessment, and you get those credits. So at the end of 4 years, there are different optional credits you can score, and that gets incentivized. So it's not a bad idea to think of those optional credits. Like an exchange program becomes an optional credit. So you can accumulate all of these and start looking at the number of ideation camps attended. Let's say, for example, in 4 years, he attends about 5 ideation camps. Then was it just attendance or was it contribution? So all these things need to have a qualification and interpreted as quantification, which will give them some credits.
Thank you, sir. So, sir, I would now like to propose the vote of thanks. So, to begin with, I wish to express my gratitude to the management of NITO Deemed to be University for always being with us and supporting us in all our endeavors. On behalf of the entire institution and management, I would wish to convey my gratitude and regards to our speaker, Professor Dr. A. Kumar Swamy, for consenting and being the speaker of the day and giving us a lot of new ideas and suggestions. I also would like to express my sincere gratitude to Professor Dr. Sriniketan sir, who is the president of IIC NITO Deemed to be University, for always being so supportive. Heartfelt thanks to our beloved principal and dean, Professor Dr. U.S. Krishna, for always supporting us with whatever ideas I've gone with. He's always supported us and he's never said a no to me. So thank you very much. I'm also very thankful to all the coordinators of the IIC, all the staff, all the students who have been a part of this program and for their remarkable presence for this webinar. I especially thank the staff development cell, the IT cell of A.V. Shetty for helping us with all the arrangements of this webinar. Last but not the least, I thank all the participants of this webinar. Because of them, it has been a huge success. So thank you everyone for being a wonderful audience. Have a nice day.
Can you send me the recording of the lecture by email?
Yes, for sure. I'll do that.
Thank you, Kumar. Thank you very much.
Thank you. Thank you, Krishna.
Next month, I want to hear at the college, physically.
Surely, I'll
talk to my interns.
Yes.
I have kept the topic for you, and they are here till September. So you must come and talk to them.
Okay. Okay.
Thank you, Kumar. Thank you very much. Thanks, Renita.
Thank you.
For conducting the program so very efficiently, so very well. Thank you, sir. Thank you, madam.
Thank you. I'll take leave. Thank you.